Good afternoon and welcome everyone to today's 30-minute interactive infection control session. What's wrong with this picture? I'm so happy you could all join us here today. I'd like to introduce my colleagues, Lisa and Allison. Each of us will be taking a turn today to present and get your feedback on a common scene in healthcare. Let's see how many infection control risks we can recognize and discuss infection control actions we can take to help keep everyone safe. I want to welcome you back if you were able to attend our previous two interactive sessions in this series. And I'm happy you could all join us today. And we're excited to interact with you and share your thoughts and ideas on how to recognize risk to prevent and control infections in healthcare. My name is Stephanie Doyle. I'm an infection prevention training liaison here at the Rhode Island Department of Health, as are my colleagues presenting here with me today. Our diverse experiences have led us here to educate you and continue to learn about challenges you have and experiences in your everyday work in healthcare. I'd like to also introduce Abby Anderson. She's our Project First Line Rhode Island project assistant, and she is here behind the scenes in support of today's webinar. Please take a look at the chat. You'll find a link for the pre-session survey. This will need to be completed in order to receive a certificate of training for today's session. And while you're there, you can introduce yourselves, telling us your name and where you're coming in from. And feel free to add your email if you'd like to be added to our distribution list to receive notifications of upcoming events. This session is brought to you by Project First Line Rhode Island under the Center for Acute Infectious Disease Epidemiology at the Rhode Island Department of Health in partnership with the CDC. So we're using Zoom today, so I'm sure everyone is familiar with Zoom, but if not, I'll let you know everyone is muted. If you'd like to speak, please use the raise hand icon at the bottom of your screen. We'll be using the chat for our interactive session for your feedback, and we also have the Q&A box available. If you have any questions, we can address those at the end of the session or through email. All right. So on our agenda for today, we have a couple of session objectives. Then we'll begin our interactive infection control challenge. We have some announcements at the end, and we'll leave some time at the end for some Q&A. So let's get started. So at the end of the session today, you'll be able to understand how infection control actions can prevent infections and identify and reduce infection control risks. So when healthcare takes a turn, are you guys ready? In each scene, we'll ask you to take a look and enter into the chat what you recognize as an infection control risk. Then we'll go one step further to determine what actions we can take to minimize or eliminate infection risks in each scene. Your feedback is key in figuring out what can be done to keep everyone safe. Thanks so much again for coming. I'm now going to hand it over to Allison Thurber to go over our first scenario, a busy emergency department. Take it away, Allie.
All righty. Good afternoon, everyone. So as Steph mentioned, our first infection control scene we will look at together is the scene that you see before you in an emergency room. So emergency rooms certainly pose some challenges in regards to infection risk and control because of the busy, fast-paced nature. Because of that fast-paced emergency nature, infection control may not be as simple to maintain, but it is important to understand and recognize infection risks that we can control. So let's take a look at this first scene, a scene many of you may be familiar with, whether you were visiting or working. It looks like a nurse or other licensed staff is attending to a patient in the ER. So there are 3 areas in this photo where we could improve upon our infection control practices to decrease the spread of germs. You may see more than a few, but we will focus on these core 3. So I will invite you all to use the chat box to share what you think have gone wrong in this photo. Again, looking at this photograph of an ER, where do you see infection risks? And you can just kind of throw them in the chat box and we'll go one at a time. All right, so let's go with the first one that we have here. A lot of people are putting the improper mask wear underneath the nose. Perfect, and you guys got it. So not wearing a mask over the mouth and nose. Some germs can spread through the respiratory droplets that people make when they breathe. So when using a mask for source control, it's important the mask covers the mouth and nose to keep respiratory droplets from reaching others. And when you're using the mask not for source control and you are protecting yourself, then it's also important that you wear the mask appropriately, covering your mouth and nose to cover the mucous membranes from any sort of respiratory droplets that can spread when others are spreading to you as the healthcare worker. All right, so back to this picture. Let's see what else we have. Right in front of me, it looks like a few people said PPE on the computer. So it looks like there's a face shield on the computer. Let's try that one. Perfect. So that is another one, hanging PPE on a computer. Clean PPE should be stored in a way so that it is obvious that it's clean. For example, in a labeled container or clearly identified area. The area should be separate from any sort of dirty areas in the ER, and staff should know where that is. Used PPE has germs on it, so if this PPE is used, it should be thrown away, or if it is reusable, it should be cleaned and stored appropriately. In that case, you should also know as staff where that place is to access the PPE when you need it. All right, and last one, it looks like as we're going, people are just throwing them in the chat here, which is great. So it looks like a lot of other folks are writing bloody linen in a linen bag, linen on top of the cart in the hallway. Let's try that one there. Perfect. So overflowing dirty linens bag. So used linens are covered in germs, of course, and should always be placed in a marked bag or bin. Especially this linen here could be considered biohazard because it does look pretty saturated in blood. So when you're working, take the time to make sure that the linens are fully inside the container where no one will touch them so that the germs cannot spread to others. Also, if you walk by a linen bag and it's overflowing, maybe notify EVS staff that it needs to be changed. Maybe someone's just not aware, or put on some gloves. Make sure that that linen is secure in that bag yourself so that others aren't put at risk. So we got all three in the emergency room. I want to take some time now to reflect here and speak about your professional experiences. So have you encountered any of these situations within your workplace? And again, a quick response in the chat would be great. Go ahead and throw that in there. It doesn't have to be in the ER. I've certainly seen my share of incorrect mask wear on the floors or in the community, departments of health, things like that. Mask wear is definitely a challenge. I can attest to that. I think mask wear is difficult, especially now because there's some fatigue involved. Overflowing linen laundry bags, definitely seen that. I don't know if others have seen that as well. Or PPE not labeled in the right spot, dirty PPE mixed with clean PPE. Great. So what makes these infection control problems more common in the ER setting? And I know I've mentioned it's a fast-paced environment, but is there anything else that you think kind of poses more of a challenge in the ER setting? Again, you can put that right in the chat. So some infection control challenges in the ER is, not knowing exactly what people have when they come in. So kind of taking into account some standard precaution thoughts there. It's fast-paced again. Also maybe spacing, right? You have a lot of people in the ER, so overcrowding, making sure that you can still control to some extent what's happening in the ER. And lastly, what are some actions we can take to prevent infection control risks? So some of these, you can either speak to them specifically or in general. What are some actions that we can take, more specific to this setting? So we have some responses of surveillance and education. So kind of like a broader education for staff, personal responsibility, like I mentioned with the linen bag, If you see something, do something about it. Don't wait for someone else to do something about it. Re-educating. That's great. So I appreciate all of your feedback. If you do have any questions about this scenario specifically, or the next two scenarios, please put them into the Q&A box and we will answer them at the end of the webinar. So thank you all again for your participation, your feedback. I'm going to hand it back over to Steph for your next scenario.
Great job, everyone. Thank you so much, Allie. All right. So now we're going to move over to our nurses station. So for our next scenario, we're looking here at a busy healthcare facility workstation. So how many of you are familiar with this scene as a healthcare worker? If you've been on either side of this scenario, have you witnessed some infection risks in your own practice? Now let's look closer. So we're going to identify 4 infection control risks in this scene. So healthcare workers need to be extra aware of where germs are found and how they can be spread to surfaces and people. We can help stop infections when we recognize the risk for germs to spread. So in this image, select 4 problems that need to be fixed to reduce the spread of germs. All right, so I see some people are giving me some answers there in the chat. Very good, very good. Looks like you guys identified, first you saw that food there sitting on the nurse's station. So let's look at that there. Yes, absolutely. Whose pizza is that, really? Why are you eating it at your workstation? So food at the nurse's station, it can get contaminated, blood or body fluids on it. Food spilled on dry surfaces can become a place for germs to grow. So yes, that is a half-eaten piece of pizza. What would you do if you saw this? What are some risks of having food out at the workstation? So OSHA actually requires healthcare organizations to evaluate the workplace to determine locations where potential contamination may occur and prohibits employees from eating or drinking in those areas. Is this one of those areas? I would say likely it is. Okay, good, good, all right. So I see someone else, some of you have identified, yes, PPE on in the hallway. PPE on, so we'll go and look at that healthcare worker who's walking down the hallway. She has gloves on and a face shield. So wearing gloves between patients or tasks. Gloves can spread germs to people and things just like dirty hands. Same pair of gloves should not be worn for more than one patient or task, and they should be removed and thrown away after they are used. So how many times have you guys seen this? Or have you seen this in your practice? I know I have. I always think when it comes to gloves, one and done. Gloves are great PPE, but should never be used as a substitute for hand hygiene. Now she's most likely contaminated that clipboard, and others may need to use it. Is her face shield also contaminated as well? Did she just leave a room that required transmission-based precautions? So pushing a wheelchair, also a good example. Someone pushing a wheelchair with gloves on. So those gloves are most likely contaminated in the hallway. So think about what you would do if you saw this in your workplace. All right, so we've identified 2, so we have 2 more to go. Take another look here. I see that a couple of you have identified this personnel here with a syringe. Looks like an uncapped needle. Yep, so you guys have identified that as well. So we do have a healthcare worker here. Looks like she may be preparing medication at the nurse's station. So a healthcare worker handling a syringe. To reduce the risk of germ spread, certain tasks should not be conducted in public spaces such as hallways or nurses' stations. Medications and vaccines should be prepared in clean, designated spaces, not at the nurse's station. All right, very good. If you're preparing an injectable medication, what are some precautions you should take and why? Is that surface she's working on, is that clean, free of clutter, or is it contaminated? And does she have the proper equipment available to maintain her sterility? Yes, so we should definitely have designated areas to prepare injectable medications. Good identification of risk. All right, so we have one more glaring at us. Yep, you don't see any alcohol wipes, exactly. Lotion, yes, you guys have identified also this tub of lotion that's sitting there out at the nurse's station. I've seen this so many times in practice, and sometimes I just cringe just looking at that tub of lotion. It can definitely pick up bacteria if multiple people are using it, dipping their hands in. It's a great reservoir for germs to grow and multiply and spread to others. So who does this lotion belong to? Is it a patient's? Is it one of the staffs? We don't know. So we wouldn't want to use that potential bacteria growing in there. So what's growing in there? We don't know. We don't want to know. I would always see the lotion left out at the nurse's station. So, yep. Very good. So you guys identified the 4. There potentially could be more, but you did identify the 4 that we were looking at here in this scenario. So you guys did a great job identifying risks. So have you ever encountered anything similar to this in your workplace? So either as a visitor or a contractor going into a healthcare facility, or a healthcare worker working in a facility that does have a busy workstation like that. So have you guys ever seen this in your practice? And if so, why do you think they're so common? Why do you think people eat at the nurse's station or just leave things out? Or maybe prepare medications. Have you seen that occur in your practice? I know I've seen nurses preparing meds, on the movable computer, the computer on wheels. Is that acceptable? Probably not the best practice. You definitely need a designated area to prepare meds. And what would you do? What kind of infection control actions would you take in this scenario? How about that person walking in the hallway with the PPE on? Yep, meetings to make sure everyone's on the same page. That's a great idea. Yep. Real-time education, excellent. Yes, don't be afraid to speak up. It doesn't have to be argumentative or just a quick reminder. Just to keep everyone safe. We're all trying to accomplish the same goal of keeping everyone safe. So just a quick real-time education reminder is a great idea. Yes, it's so true. Nurses really rarely have time in a busy scenario to take a break. So sometimes people will eat at the nurse's station, but you can help your coworkers and say you'll cover them for 5 minutes if they want to go eat in the break room. There should be a designated place where people want to eat, where people can eat. So do a quick favor for someone if they want to eat quickly or use the bathroom. I know that's always an issue too with busy nurse's station. Clean, accessible place to prepare meds. Yep. And if there's not, you can go to management and make sure that they're aware that you need these things to practice safely. All right, very good. You guys did great. So we'll move on to our last scenario, and I'll hand it off to Lisa. Thanks so much.
Okay, thanks, Steph, and good afternoon, everyone. You guys are really doing a great job, and this is going to be our last scenario. This can be a common scenario in your workday, or you may have been that patient waiting to be seen in an outpatient exam room. So in this exam room, there are 4 problems that may cause germs to spread. So go ahead, and we're going to share, again, like you have in the other 2 scenarios, some infection risks that you identify in this exam room. And again, there are maybe 4, but we're going to go, there might be more than 4, but there are 4 we're going to find today, but there might be more than 4. And we'll review and talk about the infection control actions that we can take. All right. Well, I think that a lot of people first are seeing, which stands right out at you, is the urine specimen. Yes. So that urine specimen is sitting right there on the counter space where other healthcare tasks are going to be performed, such as drawing up medication. And those germs on the outside of the urine cup, that sample cup right there, they could spread right on the countertop and contaminate any object that is placed on that counter or near there. So body fluid samples such as blood or urine should always be placed in a biohazard bag to prevent the spread of germs. Good job. All right, and let's see what else. That sharps container. Oh yes, that overflowing sharps container. So we have seen this many times. I don't know if any of you have, but it's a common sight, unfortunately. So this filled sharps container is a hazard because it increases the risk of someone being poked with a dirty needle or sharps instruments that have germs on it that people hastily put in there, right? So we're moving fast, throwing it in there and not thinking that you're going to potentially put somebody else at risk. So to prevent the germs from spreading, it's important to regularly remove or replace the sharps container before they become too full. And as healthcare workers, it is important for everyone to monitor this container from overfilling. Not just leaving it up to EVS. I think we all have to share that responsibility and always look out for each other because it is a hazard. All right, what else have you guys been finding? We have 2 more things. And let's go check out and see the supplies. You're right, those patient supplies. They're right in that glass jar near the sink. Healthcare supplies should not be kept near the sink because they can become contaminated by the tap water spraying on them. And while tap water is clean, it's not sterile. And germs from the tap water can spread to other surfaces and objects. Places that are frequently wet with tap water, like the sinks and the counters surrounding the sink, can be a risk for germs to spread. This is why healthcare supplies should be kept away from the area that can be wet and frequently sprayed by the water. You may have even seen the barriers. Some offices or even, actually most of the outpatient exam rooms now, you'll see they have barrier shields that are placed on countertops if it's a small area. And they'll put that protector right there so that the water does not splash out. But medical supplies should be kept away from there. And let's see what else. Has anybody else found the last problem in this scene? Let me see. I don't think anybody picked up on this one. But, and if you did, I'm sorry, I didn't see it, but I don't see it staring. If you look at the vent in that room is blocked by the waste, the trash can there, the waste basket. So it's right there below the sharps container. You can see it. A blocked air vent may not seem like an opportunity for germs to spread, but good ventilation can help remove things from the air that we don't want to breathe in, such as chemicals, dust, or even small respiratory particles. So if you ever see an air vent blocked by something that you can move, it's movable, like such as this trash can, or if there's a chair blocking it, be proactive and move it out of the way to promote for good ventilation. If there is something that is blocking it that cannot be moved, you want to notify management or whoever's in charge of that particular area. So you guys all did great. Those are all the 4 problems in this exam room. You did an excellent job. So in your workplace, have you seen something like this? Or have you been that patient in that room and noticed all these infection risks around you? And why do you think it's happening so often in that area? Why is it common in that area? Why does it still happen? And then what can we do to prevent it? So let's see. You can put anything you'd like in that chat there. A lot of this too, when you, like we were saying earlier in the other scenes, we're all working very fast and in a hurried fashion. So like that urine specimen, you probably have seen that. But it's just taking that time to slow down, put it in the biohazard bag, keep things in order. It's difficult when you're moving fast or you have a small area to work in. You might not have that extra space. And sadly, we've seen some outpatient offices. Yeah. So politely, you're right. Mentioning it to your staff. Make sure that housekeeping has infection control training, not just the medical staff. Absolutely true. letting them be aware and to identify all these infection risks. Good job. I appreciate everybody participating. So let's move on. Takeaways for the session. So we know that infection control actions can prevent the spread of germs. And understanding environmental infection control will prevent infection, like we said, but it protects you and your patients. So good job today. We really appreciated it. And for your certificate of training, if you'd like to receive that, you are required to complete the pre-session survey and the post-session survey. The post-session survey will be emailed to you tomorrow, which is May 16th. And you want to get that completed by midnight on May 22nd. And then the certificate will get emailed to you May 25th in PDF form. And as always, we'd like you to follow us on Project First Line Rhode Island. We are on social media. Follow us on Instagram, Facebook, LinkedIn. Visit our website, projectfirstlinerhodeisland.com. You'll find Project First Line Rhode Island CDC materials and also printable resources there. Our recorded webinars are also on that site. And a couple of months ago, we launched our Spanish language webinars, which are also on our website. So we're excited to offer both English and Spanish language infection control trainings. And next month, we'll be offering just that. Hand hygiene, cleaning, disinfection, and sterilization, a refresher course for EVS personnel. It's going to be presented in both English and Spanish language. Allison Thurber will be presenting the English language on June 5th, 12 to 1. And Jacob Figueroa will be presenting the same session, but in the Spanish language on June 12th, 12 to 1. So we hope you join us and share this along with your friends and colleagues. And here are our references for today's session. And we thank you so much for everything that you do. And we appreciate you joining us.
Thank you all.
We
want to respect time. So if you do have any questions, please feel free to email us and we will answer back in a timely manner. Again, thank you all so much for joining us.
Thanks so much.
Have a great day.
Hope to see you again.